The U.S. has the worst maternal mortality rate among developed nations, and Georgia ranks as one of the worst states in the country. Experts say communities of color here will be disproportionately affected, especially since for years they've already faced barriers when it comes to maternal health. Paula Suro explains.
Let's talk maternal mortality. Georgia has one of the worst ratios in the country. According to the Center for Reproductive Rights, Black women in the state are more than 3 times likely to die from pregnancy-related complications than white women. And Black babies here are twice as likely to die than white babies. Feminist Women's Health Center says overturning Roe could raise those alarming statistics even further.
There are folks who have access and privilege that are still going to be able to access abortions. Folks who already go through so much to come to our center. These are folks who are Black, who are brown, who are immigrants, who are refugees, who are survivors of violence. Those are the folks that have the most difficult time accessing the most important critical abortion care that they need.
But why? Aside from accessibility and transportation, the nonprofit organization says there are also financial barriers.
Not everyone is documented, so then there's another issue of health insurance. Even when folks do have health insurance, there are a lot of services that are not covered.
Hispanic Alliance Georgia explains many women from communities of color end up going straight to the hospital to give birth without seeing specialists throughout the pregnancy, without checking on their baby's health or their own, leading to more deaths.
We're talking about $150 a month for just the prenatal care. Yes, they can pay in installments, but for those living in poverty, that really means that they have a debt at the end of their pregnancy.
Latinos also face a language barrier.
They're very disconnected from the services.
Lack of education and medical mistrust has been a problem too. In Georgia, 23% of Black women and 49% of Hispanic women said they don't have a healthcare provider.
These are the folks that will be impacted by this the most, I feel.
And now they'll try to figure out new ways to help those already hard to reach.